Hello, everyone. I'd like to talk about the common mistakes individuals with high blood pressure tend to make, which can hinder their treatment progress and potentially cause harm. High blood pressure is a serious condition that, if not managed properly, can lead to cardiovascular complications. Therefore, it is crucial for patients to strictly adhere to their cardiologist's instructions in order to have a similar lifespan and quality of life as someone without high blood pressure. If you have hypertension, it is possible that you may be making one or more of these mistakes. Stay with me until the end of the video to learn how you can take care of your health, even with high blood pressure. We all know that high blood pressure is the leading cause of heart attack and stroke, but what about the most common mistakes during an appointment? We understand that high blood pressure is the most significant risk factor for cardiovascular diseases in the United States. To give you an idea, hypertension causes around 500,000 deaths per year in the US alone. The reason why high blood pressure is so dangerous is because it increases the risk of atherosclerosis, which is the accumulation of fat in our arteries. From birth, fat builds up in all arteries, including those in the heart. Hypertension accelerates this process of fat accumulation in our arteries, making it the leading cause of acute myocardial infarction or heart attack. If your systolic blood pressure consistently remains above 140 millimeters of mercury or your diastolic blood pressure remains above 90 millimeters of mercury, it's crucial to consult a reputable cardiologist to diagnose hypertension and begin medication if required. However, what are some common mistakes made by patients when visiting their doctor? Blood pressure is a common condition that affects millions of people. One of the most common mistakes that patients with high blood pressure make is failing to take their medication even if their blood pressure reading appears to be normal. For instance, if a patient takes their medication at 8 a.m. and then checks their blood pressure to find it is 11 times 7, they may decide not to take their medication for the day, assuming that their blood pressure is under control. However, this is a wrong approach. The medication from the previous day may have worn off, and 3 or 4 hours later, their blood pressure may rise to 16/9. If they do not check their blood pressure again and take their medication, they will have elevated blood pressure for the entire day. To avoid this mistake, patients need to follow their doctor's instructions and take their medication as prescribed, regardless of their blood pressure reading. The goal is to prevent their blood pressure from rising, not waiting until it spikes before taking action. By taking their medication at the right time, patients can maintain their blood pressure under control and minimize the risk of complications associated with high blood. I often come across this situation in my clinic. Despite my repeated advice not to do so, patients frequently stop taking their medication regardless of their blood pressure readings. They assume that if their blood pressure is normal, say 11/7 or 10/7, then they don't need to take their medication anymore. However, this is a misconception that can be extremely dangerous. By doing so, they risk their blood pressure soaring to high levels, as high as 18/10, as I often observe when they return to the clinic. Therefore, this is the first and most crucial mistake that hypertensive patients make. Second mistake, there are patients who have had a heart attack and who may not necessarily have high blood pressure. However, patients who have already had a heart attack often need to take medications that are also used to treat high blood pressure. These patients may need to take drugs from the classes of ACE inhibitors, ARBs, and beta blockers, which are medications for high blood pressure. Sometimes, these patients may see the label and assume they don't need to take the medication because they don't have high blood pressure. As a doctor, I often have to explain that I prescribe these medications not just for high blood pressure, but also because they help protect the heart muscles from future heart attacks. These medications are often the same ones used for high blood pressure and can help prevent heart failure and other complications. So, if you have had a heart attack, even if you don't have high blood pressure or if you think that doesn't apply to you, your doctor may prescribe medications for high blood pressure. Don't stop taking them without consulting your doctor, as they may help protect your heart and prevent future health problems. One of the most common mistakes I see in my day-to-day work as a doctor is when patients come in for their first appointment without a prior hypertension diagnosis, and then say something like my blood pressure was 180/100. So, I started taking my mom's blood pressure medication. Now, is this something you should do if your blood pressure is 180/100? Absolutely not. If your blood pressure is that high, you should go to the emergency room and get evaluated by a doctor. Sometimes, just relieving the headache can bring your blood pressure down a bit. During the visit, the doctor will check your blood pressure again and determine if it's necessary to start an antihypertensive medication, even during the first evaluation. If a person's blood pressure is over 18, healthcare providers in some countries tend to prescribe medication during the first consultation. However, taking medication from family members or neighbors is not recommended. Patients may assume they are doing well by taking medication, but this may not always be the case. For example, certain medications such as enalapril and captopril, which are ACE inhibitors, may not be suitable for individuals with high potassium or creatinine levels indicating kidney failure. Taking these medications can lead to increased potassium levels, resulting in cardiac arrhythmias due to hyperkalemia. The risks associated with taking antihypertensive medication should not be underestimated, particularly if a person's kidneys are weak. Although ACE inhibitors may be prescribed for mild to moderate renal insufficiency, taking this medication with advanced renal failure can result in kidney failure. It is essential to be cautious and aware of the potential risks of medication. Patients may take captopril without knowing their potassium or creatinine levels, or they may start taking a medication like hydrochlorothiazide from a family member. Hydrochlorothiazide is a thiazide diuretic that is often prescribed for hypertension. When you're taking diuretics, you are excreting a significant amount of important electrolytes, such as sodium, potassium, chloride, and so on. This not only results in fluid loss and decreased blood pressure, but also causes loss of crucial elements. For instance, hydrochlorothiazide may worsen glucose levels, so if you are a pre-diabetic and start taking the antihypertensive drug, you may end up becoming diabetic without medical supervision. Hydrochlorothiazide is also known to exacerbate uric acid levels, so if you enjoy consuming meat, beer, and beans and have a uric acid level of 9, taking hydrochlorothiazide may trigger gout attacks and crystal deposition that could lead to kidney stones, which is not recommended. Another example is the use of beta blockers including atenolol, propranolol, bisoprolol, which are usually reserved for last resort because they have minimal impact on blood pressure and can negatively impact sexual appetite if not used correctly. Taking the wrong medication for a prolonged period, even if it has lowered blood pressure, can lead to sexual dysfunction. I just wanted to say that if you noticed that your blood pressure was not at the optimal level of 14/9 and instead was above 130/85, it is important to seek the advice of a reputable cardiologist to diagnose and determine whether medication is necessary for proper treatment. Alright folks, if you enjoyed this video, don't forget to subscribe to the channel. Give it a thumbs up, click the bell icon to receive all notifications, and share the video with your friends. So, I'll be wrapping up now. Big hug and see you next time.